aimed to flatten the curve of the infection so that our health system would be better placed to care for the large number of people who would be needing care. As a result of the decisive action that we took then, and particularly through your cooperation, one of the ways of measuring the rate of transmission and are anxious for the safety and well-being of your loved ones. You are worried about the possibility of getting infected yourself in a taxi or on a bus, at work, at the shops, at school or university, whilst you are visiting a clinic or even visiting a hospital. These concerns are understandable and reasonable because as the country gradually opens up, as we resume more activities, the risk of infection inevitably increases. Yet even though the risk of infection is greater, it is by no means inevitable. Through our behavior as individuals, we can reduce the likelihood that we will get infected or even infect others. And it is through our personal and collective actions that we can continue to delay the rate of infection across society in our communities. Studies show that wearing a cloth mask or similar piece of clothing that covers both your nose and mouth at all times when one is in public is one of those measures that reduces the rate of transmission of the virus. Now, millions of South Africans, including small children, are now wearing cloth masks whenever they leave home. There are, however, some South Africans who have not yet taken up the practice of wearing masks. We would like to encourage everyone in our country to wear masks when they are in public. Let us make sure that we do not share masks and that we wash our masks thoroughly in soap and water after each use. The wearing of masks, however, is no substitute for regular washing of hands with soap and water or sanitizer, and maintaining a distance of at least 1.5 meters from other people. Let us all remember not to touch our faces with unwashed hands and clean and sanitize surfaces that we touch regularly. We should also keep in mind that social distancing is still one of the most effective ways of reducing the spread of the virus. These basic practices are becoming even more important now as we ease the lockdown and enter a new phase in our coronavirus response. These are still the best ways of containing the spread of the virus. Our medical experts have advised that interventions which some people are embarking on, such as setting up fumigation tunnels and body spraying, should not be used as they have no proven benefit and may even be harmful. From the outset, we knew that extreme measures were needed to slow community transmission. But we also knew that a nationwide lockdown could not be sustained indefinitely or forever. With a move to alert level 3 from the 1st of June, our prevention response is now largely focused on the simple everyday things that each of us can do to protect ourselves and our communities. It is about each one of us taking personal responsibility whenever we are or for curbing the spread of the disease. The power to defeat coronavirus is clearly in our hands. Our response is now also more focused on hotspot areas with the greatest rate of infection and sending multidisciplinary health teams to contain the outbreaks and ensure those with the infection get the necessary care. At the same time, we have massively increased screening for coronavirus symptoms throughout the country, at every workplace, school, university, shopping center, place of worship, taxi rank, or other public spaces where people gather. Like many other countries, South Africa has been affected by the global shortage of coronavirus test kits and other materials. We have therefore had to become more targeted in our testing, prioritizing patients in hospitals, healthcare workers, vulnerable people like the elderly, and in hotspot areas. Although the situation is improving, we continue to experience delays in testing, and we are addressing this. This has severe implications for effectively managing patients with infection as well as tracing the contacts of infected people. We are therefore using every avenue available to source the supplies that we need and to increase our testing capacity and improve the turnaround time. Among some of the initiatives that we have pursued together with other countries on our continent is the groundbreaking Africa Medical Supplies Portal. This is a single continental marketplace where African countries can access critical medical supplies such as test kits from suppliers and manufacturers in Africa and around the world in the necessary quantities and also at competitive prices. This platform will complement the work that is being done to ensure that we have the medical equipment, personal protective equipment, and hospital facilities to manage the anticipated increase in COVID-19 patients. The coronavirus pandemic is not only a global health crisis, it is also a global economic crisis of ever-increasing proportions. No country, no industry, and no person is unaffected. Here in South Africa, the pandemic has severely disrupted the livelihoods of millions of our people. As you are aware, many businesses that stopped operating on the 27th of March, when the lockdown came into effect, have not yet been able to reopen under current restrictions. These include large companies with many thousands of employees and many more small companies with just a handful of employees. This means that there are businesses that have not earned any income or revenue, and individuals who have not had any salary for over 80 days. Even with the measures that we put in place to support companies, workers, and poor households as part of the 500 billion relief package that we announced, there is a limit to how these businesses can be closed. When I announced that the country would be moving to alert level 3 from the 1st of June, I said that we would be giving consideration to the reopening of other sectors of the economy if the necessary safety precautions can be put in place and maintained. Following further discussions with industry representatives on stringent prevention protocols, and after advice from our scientists and consultations at the provincial level with our premiers, as well as discussions in the National Coronavirus Command Council, the Cabinet has decided to ease restrictions on certain other economic activities. And these activities include restaurants for sit-down meals, accredited and licensed accommodation, with the exception of home-sharing accommodation like Airbnb, conferences and meetings for business purposes, and in line with restrictions on public gatherings. Cinemas and theaters to be aligned to limitations on the gathering of people, casinos, personal care services, including hairdressers and beauty services, non-contact sports such as tennis, golf, cricket, and others. Contact sports will be allowed only for training and modified activities with restricted use of facilities. In each instance, specific and stringent safety requirements have been agreed by the various representatives of these disciplines and businesses, and those will need to be put in place before a business or an activity or a discipline can reopen, and protocols will need to be strictly adhered to for those entities or businesses to remain open. Announcements will be made in due course to give details of these measures and indicate the date from which these activities will be permitted. We have taken this decision with due care and seriousness, appreciating the risks associated with each activity and the measures needed to manage those risks. Altogether, these industries employ well over 500,000 people, and this is the number of people they employed before the lockdown. We have had to think about these people who are employed in these industries and those who depend on them for their livelihoods. Through the easing of the lockdown, we are continuing to balance our overriding objective of saving lives and preserving livelihoods. It is important to remember that this is a global pandemic and that most countries are facing exactly the same challenges that we are facing, and they must find ways to resolve the dilemmas, exactly the same dilemmas that we are facing. We are therefore working closely with international agencies and other countries in responding to the virus. As chair of the African Union, we are involved in forging a common approach across the continent, ensuring that we mobilize resources and develop strategies to ensure that no country is left behind. There are currently over 250,000 confirmed cases in Africa, and there have been more than 6,700 deaths. This is relatively low compared to the global number of cases, which has now passed 8 million, largely because African countries acted swiftly to implement national lockdowns. However, we can expect infections in Africa to rise as countries start easing restrictions in the face of severe economic pressures, and we are working together as a continent to meet that challenge. It has been particularly important for us to open up personal care services because this is an industry that predominantly employs many women of our country. The last 3 months have been particularly difficult for the millions of women who work as hairdressers, in spas, as therapists and technicians. Many of these women are in businesses that are also owned by women, and a source of income is earned from these businesses, and many of them are informal businesses. Given women that they are involved in these industries, this will give them the support to become financially independent, and this is an important priority. It is with the heaviest of hearts that I stand before the women and the girls of South Africa this evening to talk about another pandemic that is raging in our country: the killing of women and children by the men of our country. As a man, as a husband, and as a father to daughters, I am appalled at what is no less than a war that is being waged against the women and the children of our country. At a time when the coronavirus pandemic has left us all feeling vulnerable and uncertain, violence is being unleashed on the women and children of our country with a brutality that defies any form of comprehension. The women of our country are being raped. They are being killed by men. These rapists and killers walk amongst us. They are in our communities. They are fathers, they are brothers, they are our sons and our friends. They are violent men with utterly no regard for the sanctity of human life. Over the past few weeks, no fewer than 21 women and children have been murdered. Their killers thought they could silence them. But we will not forget them, and we will speak for them where they themselves cannot. We will speak for Tshegofatso Pule, Naledi Phangindao, Nompumelelo Chaka, Nomfazi Gabata, Nwabisa Nkwadela, Alicia Korki, and Lindelwa Penny. All of them are young women, or were young women, who were killed by men. We will speak for the 89-year-old grandmother who was killed in an old age home in Queenstown. The 79-year-old grandmother who was killed in Brakpan in Gauteng, and the elderly woman who was raped in KwaShwayimani in KwaZulu-Natal. We will speak for the innocent souls of Tshegofaso Pule's unborn daughter, who had already been given a name. We will also speak for 6-year-old Renacia Kochi and the 6-year-old child found dead in the veld in KwaZulu-Natal. These women are just not statistics. They have names, and they have families, and they have friends. This evening, our hearts, our thoughts, and our prayers are with them. I want to commend the South African Police Service for their excellent work in arresting almost all of these alleged perpetrators. As these suspects make bail applications this week, I have the utmost confidence that our courts will send the strongest of signals that such violence has no place in society. At a joint sitting of Parliament in September last year, I announced an emergency response plan to combat gender-based violence and femicide, and that 1.6 billion rand in government funding would be made available to support the implementation of the plan until the end of the financial year. We now have a national strategic plan to guide our country's national effort against gender-based violence. During the lockdown period, we have ensured that survivors of gender-based violence have access to support and services, including GBV hotline, shelters and centers, providing support to victims of sexual violence. Since December last year, 10 government-owned buildings have been handed over to the Department of Social Development by the Department of Public Works and Infrastructure to be used as shelters, addressing one of the biggest challenges facing survivors who want to leave abusive relationships. Over the last 18 months, we've made demonstrable progress in broadening access to support for survivors. 13 regional courts have been upgraded into sexual offenses courts. To support the work of law enforcement, 7,000 evidence collection kits have been distributed regularly to every police station in the country, and there are now over 1,000 survivor-friendly rooms at police stations. Many police, prosecutors, magistrates, and policymakers have undergone sensitivity and awareness training, and over 3,000 government employees who work with children and mentally disabled people have been checked against the National Register of Sex Offenders. Legislative amendments have been prepared. Among other things, minimum sentencing in cases of gender-based violence, bail conditions for suspects, and greater protection for women who are victims of intimate partner violence. I urge our lawmakers in Parliament to process these amendments to our laws without much delay. Our courts have been firm in dealing with cases of gender-based violence. Even during the lockdown period, they have handed down life sentences and multiple life sentences to perpetrators. I want to assure the women and the children of South Africa that our criminal justice system will remain focused on gender-based violence cases, and that we can expect more arrests and more prosecutions against perpetrators to follow. The perpetrators of violence against women and children must receive sentences that are fit for the horrific crimes that they commit. It is deeply disturbing that the spike in crimes against women and children has coincided with the easing of the coronavirus lockdown. According to the police, violent crime, especially murders and attempted murders, have increased since Alert Level 3 took effect on the 1st of June. Cases of abuse of women and children have also increased dramatically. We need to ask some very difficult questions of ourselves as a society. In particular, we need to examine the effect of alcohol abuse, not only on levels of violence, but also on road accidents and reckless behavior. Several international and domestic studies show clear linkages between alcohol abuse and gender-based violence. Of course, it is not alcohol that rapes or kills a woman or a child. Rather, it is the actions of the men of our country, violent men. But if alcohol intoxication is contributing to these crimes, then it must be addressed with urgency by all of us. We need to draw lessons from this lockdown and decide how we can protect our society from the abuse of alcohol. Certainly, we need to provide greater support to people with drinking problems, including through rehabilitation and treatment. We need to encourage responsible drinking, especially among young people. We need to be tough on liquor outlets that violate the terms of their licenses and who sell alcohol to those who are underage. But we will also need to look at further, more drastic measures to curb the abuse of alcohol. Many people and many leaders in our society continue to complain about our people's behavior after abusing alcohol. Ultimately, the success of our fight to end gender-based violence will require the involvement and support of our entire society. If we are serious about ending these crimes, we cannot remain silent any longer. These perpetrators are known to us, they live amongst us, and they are in our communities. By looking away, by discouraging victims from laying charges, by shaming and insulting women for their lifestyle choices or their style of dress, we become complicit in these crimes. I once again call on every single South African listening this evening to consider the consequences of their silence. As a country, we find ourselves in the midst of not one but two devastating epidemics: the coronavirus epidemic and the gender-based violence epidemic. Although the two are very different in their nature and cause, they can both be overcome if we work together, if we each take personal responsibility for our actions, and if we each take care of each other. We can overcome these two epidemics. The road ahead will be long and difficult, but the task of recovery will also be long and considerable. But if there is anything that we have learned in the last 100 days, it is this: that we are a resilient, resourceful, and determined people. I do believe that we can overcome, and we can overcome gender-based violence, and we can also overcome this pandemic. It is indeed in all of our hands to ensure that we do overcome. I believe that we shall overcome. May God bless South Africa and protect her people. I thank you.